CIT stands for Crisis Intervention Training, and what that is, it's a collaboration between law enforcement professionals, medical professionals, and mental health care professionals, trying to bridge that gap between them to be more effective when we respond to mental health crises, and also develop relationships between those groups so that they're not working definitively in their own group and they're working together more as a team. It trained us and educated us both on how to respond to different things, how to de-escalate from certain situations, but also recognizing those situations, recognizing when somebody is in a mental health crisis, some of the signs and symptoms of those things, and then they talked about de-escalation, different things that we can do for those different crises. Within just a couple weeks after that training, one of the situations I had responded to was it was a civil matter. A woman had broken up with her boyfriend that she had lived with, and she had come to pick up a ring. Talking with her, I could tell there was something not quite right, or that she was dealing with something. And the training helps me recognize that and think I need to take a little more time with people. And I talked to her for quite an extensive time, and come to find out she was going through depression. She had been suicidal recently, and we were able to work with her to establish a meeting with community mental health that day right there, and start working on those problems rather than just getting the ring and just doing the law enforcement approach. It was more of a team effort to try and get her the help that she needed.
Basically, we work to present to the community what Narcan is, how to use it, and where they can receive it. In 2016, the law changed that allowed that you could walk into any pharmacy and request Narcan without a prescription, and the pharmacist was then able to dispense it to you. I think of Narcan kind of like a family fire extinguisher, something we'd hope never to use, but in this day and age, unfortunately, may want to have on hand. Simply, if a child were to get into a pill bottle, if you were to forget that you took a dose and you took another one, if you're on these type of medications, as well as in the large addiction world as well, kind of thing. We are lucky here in Midland County, the fact that all officers carry Narcan with them. There have been unfortunately multiple calls of overdose whether at a party or whatnot. So the police have been there. They're able to administer it, because a lot of times the police may be able to get there faster than even a paramedic who also carry Narcan. They have been able to deliver the dose and have brought multiple patients back. It's also worked well with some of our programs like Hope Not Handcuffs, that some of these patients that have had this experience, an unfortunate experience, then may be ready to get help. There are multiple stories out there where it may not have been the first time that Narcan was used on a patient, but it was the third time, and then they realized that they wanted to get help.
So the Midland Farmers Market is located right downtown at the foot of the Tridge at the end of Ashman. We're not even sure how long it's been going, over 60 years in the current location. We, for at least the last 5 years, have had upwards of 100 and over that as far as quantity of vendors. A nice diverse market, and mostly focused on agribusiness and consumables. We actually have a financial institution partner who is able to help us accept the Bridge Card, which is SNAP, Supplemental Nutrition Assistance Program. And including that, we're able, via grant, to offer double up food box, so that those who are receiving SNAP benefits can also get an additional $20 per market day to purchase fresh fruits and vegetables. For 2019, we open on the 4th of May, and we will be both Saturdays and Wednesdays from 7 a.m. until 1 p.m.
There's a number of exercise classes offered at Senior Services, and the one that I took was the Bone Saver class, and that emphasizes strength, because we used free weights, but also emphasizes flexibility. We do a lot of stretching, and I choose to make it a balance class because I do most of the exercises without holding onto a chair, and so I have to balance on one leg while I'm lifting the other one to do some of those exercises. And I have found that I have maintained my strength. I am a senior and very active, and really value that class. It can not only keep me strong and healthy, but classes like that can be a wonderful support system. Everyone knows you and cares and checks in on you, which keeps you coming all the time.